Hi guys, welcome back to my channel, Honestly Invisibly Sick, and in today's video we're going to be talking about common misconceptions of someone with an autoimmune disease. But before I get into that, I just want to get my disclaimer out of the way. I am not a medical professional. This is just my story and what works for me. Not that I'm going to be mentioning anything to do with like advice or anything like to do with that, but I just want to get it out the way. You never know. Okay, so the first common misconception of someone with an autoimmune disease is that we're lazy. And that in fact is not true. Most people that has an autoimmune disease has figured out what triggers them, and they're just trying to operate within their ability. Sometimes if you see something like something as easy as doing laundry can cause somebody to have a flare up for 2 or 3 days after the fact that they've done the laundry. The best way that I know how to explain how our energy levels go with somebody who has an autoimmune disease, which is really what you're fighting. If you see somebody who has an autoimmune disease and they're laying on the couch, that means that their batteries are empty. They have no more energy left in the tank, and they just need to rest and try to recharge. I know before I even got diagnosed, I was constantly pushing my body for years. I was like, I'm not going to slow down. My body's not going to tell me what I can and cannot do. I'm going to push my body and it's going to do what I want it to do. And that didn't work out so great. There was times that I would do one thing and then not be able to move for the next 3 to 5 days, not be able to move around good. My joints wasn't working good. My back would be incredibly stiff and I wouldn't be able to stand up all the way. And sometimes that happens even now if I have a day that I overdo it. If I sit down and then I go to get back up, that's it. Once I sit down, I'm done. And sometimes even while I'm doing whatever the activity is, I'll notice that my body will just gradually start slowing down. My joints will start to hurt. I'll start to limp. My back will start to hurt and get really stiff, and I'll start to shake. And then I know like I've totally overdone it. Like I have to stop. And I think I mentioned a little bit of that in my fishing video that I put out because I was having a day like that before we went fishing. But anyway, so the best way that I know how to describe it is spoon theory. I'm not going to get all the way into it. There are plenty of YouTube videos out there about what spoon theory is and how it works. I'm just going to give you a little bit of a synopsis of what it is and how it works, just to kind of explain how energy levels work for somebody who has an autoimmune disease. When you are battling pain and fatigue all day, well, that's where the fatigue comes from. Mainly, there is chronic fatigue syndrome that kind of goes along with lupus, and some people that have rheumatoid arthritis have it. But basically, you're in pain all the time, and pain mentally and physically drains you, and your body is trying to function. The only way that I could think to describe it is if somebody had like a really bad accident, or where you were like super sore, you got really bruised up, and you're trying to function in your normal everyday life while your body's dealing with those injuries. Well, what you normally would do is you would go and just lay down and let your body heal and rest. Well, we have stuff that we have to do every day. We have to go on and live our normal life, even though our body is constantly in pain and constantly dealing with the inflammation and all of the soreness and the stiffness. We still have to get our stuff done. So basically, the spoon theory. Everybody starts out with 10 spoons. Somebody who doesn't have an autoimmune disease, and somebody who does have an autoimmune disease. That's your normal day, 10 spoons. So somebody who has an autoimmune disease, you get up out of bed, that's 1 spoon. You want to get ready, get dressed, shower, that's another spoon. Sometimes 2 spoons depending upon how in depth you go. Then say for a normal person, you would say, or not a normal person, but somebody who doesn't have an autoimmune disease, would do laundry for that day. And that probably would cost them I don't know, depending upon how many loads you have, maybe like 1 spoon, and that's just something that you do as you go about your normal day. Well, somebody with an autoimmune disease and who has to do laundry, it's going to cost you maybe like for 1 load, a spoon is going to cost you. Because you have to switch that, you have to put it in, you have to get the clothes together, you have to sort it, you have to put it in the wash machine, then you have to put it in the dryer, then you have to fold it, and then you have to put it away. I struggle, if I wash my laundry in one day, I am not putting it away. If there is a day to where I feel good enough that I am getting my laundry washed, folded, and put away in the same day, um, that's a rarity, and it doesn't happen very often because I hardly ever get to do that. Um, by the end of the day, whenever I'm hanging the clothes up in the closet, like if I were to try to do it, even on the days that I do, just that is my whole day to put my clothes up, like my arms are spent from hanging the clothes up in the closet. Like I have to constantly drop my arms and let them fall down and let them rest because the muscles just cannot take anymore of holding, cannot take me holding my arms up anymore. I the same thing with like if I straighten my hair, if I blow dry my hair, like I have the same issue. Or if I'm like putting dishes away, I can do it for a short amount of time, but to continue to do it and keep lifting my hands or lifting my arms is just I can't do activities like that. I just have to take a break. Like if I'm gonna do my laundry, I have to, or hang up my clothes, I have to hang up a little bit, stop, take a break, go back, hang up a little bit, stop, take a break, and go back. So basically, depending upon how much laundry you use, like you would have like you would have like 2 spoons for laundry or 1 spoon for load, depending upon how much you're doing. And if you only have 10 spoons and like you're already before lunch, you've already used 4 spoons or however much laundry you get done. Like you don't have that many. You have 6 spoons left for the whole day, and you still have to do things like you have to make lunch, you got to make dinner, you have to finish up your laundry, just depending upon what you do. And some people have to deal with going to work like that. I don't, my work's not like strenuous like that, so I don't have to worry about that. But I do have extracurricular things that I do, outside of the home with the church and all of that. So you're really kind of limited on your energy. You got to make sure that you make smart decisions about how you're going to spend your energy. And sometimes you wake up and you just don't have any spoons for that day. And sometimes you're borrowing spoons from the next day to get something done. So, like say you want to get all your laundry done in one day. Well, you may accomplish all of your laundry in one day, but you're not going to be able to do hardly anything the next day because you're going to be recovering from doing everything that you did that day. So that was just kind of a quick little synopsis. Also, another thing that I wanted to mention, let me see, I got my book right here, sorry. Oh yes, this is a really big one, that you're faking it. A lot of people think that you're just being over dramatic because they're probably the same people that are thinking that you're being lazy because they don't understand how your body works and that you can't do what you used to do, or because they don't understand you look normal from the outside and they're not thinking that there could be something wrong with you on the inside that they can't see. But the truth is there's a lot of diseases that work like that, that people can't see on the outside. I actually had a boss. She had just stepped into the role of being my boss when I was working at the hospital. I don't know if you guys remember that from my intro video. But whenever I finally had come to the point where I no longer could work, she looked at me and she said, I was telling you, I was having health problems. I was trying to explain it to her as she was just coming into the job. And she said, you look fine. You look perfectly healthy. And that's what most people have the assumption, is that if you're sick, you're going to look sick. But that's not true. Like I said, there's a lot of diseases that people walk around and have that's not even an autoimmune disease that you would never know that they, in fact, have that disease because it doesn't show on the outside. So that's not a good indicator of somebody being sick. Like, think of how many cancers that we have that most people wouldn't know that they have cancer unless they go to the doctor and the doctor finds it. So it's not like, oh, you look sick all the time because you have a disease. And an autoimmune disease works the same way. You don't look sick all the time. Sometimes you can notice, like, if somebody's limping. I get like a significant limp sometimes when I get in a flare-up. I won't be able to move around very well. So you can tell in that sense that there's something wrong with me. But on my normal everyday, whenever I'm able to move around and do what I need to do, you would never know that there's something wrong with me. And a lot of times, those of us who have autoimmune disease, we will just smile and try to get through the pain to get whatever activity or whatever it is that we need to get done, because you don't want other people to be weird around you or have to go into explaining what an autoimmune disease is and all of those things. So you just try to get through it. The other one is, oh, that you're not doing enough. You're not doing enough to help your disease. This kind of, I've heard a little bit of this said to me, not from anybody close to me, but just from other people that I've just ran into. And there is only so much that you can do. I know that there are new things out there. There are new treatments out there. But not everything is available and not everything is going to work for you. So don't think that you have to run down that next treatment for your doctor. Trust that if you have a good rheumatologist, trust that they're doing their job. And make sure that you're talking to them. It might be, if you find something, it might be worth mentioning to your rheumatologist, but don't feel like you need to chase down the cure. And I think I already covered that. And also not doing enough. Some people think like that kind of goes along with the laziness, like you're not doing enough to move around, or you're sitting too much, or people just have different opinions about things like that. And you just have to gauge your body. It is important to move. Like you can't be in a sitting position all day. It's important to move, especially if you have lupus, because you know that all the risks that we have, like we need to be moving and having our blood flowing and all of those things. But you also have to listen to your body. Sometimes I know whenever I go to get up, like my body's like, no, like you're not getting up. I might make it to the bathroom or something like that, but there are days where you just cannot do anything, and you have to listen to your body and be kind, because your body's going to tell you that you can't do anything. And I think that's hard for people to understand, because especially if you're young, that your body can't possibly be in that bad a shape, but it can be. It depends on how bad your disease is. Another one is that if we have the same disease, that we're all going to have the same symptoms and we're all going to go through the same thing. And that is in fact not the case. Your let's just say lupus. Your lupus can be, you can either have it where it's not that bad and you're still able to function and work and do everything that you used to do, and then there are those of us that have it that can't function. I had to quit my job because I had to step down from my job because I could no longer perform my duties that I needed to do on my job. So there's just, it's a wide gamut of how you're affected. Lupus affects, and rheumatoid arthritis, it affects people in different ways. Some people, like I said, are fine and can go about their everyday life and just take their medicine and not have any trouble getting around. And then there's those people that have no choice but to work, so they have to deal with it and get through it. I know with me, I could not continue on. It was not fair to me. And it was not fair to the company, because I know that I was not giving my 100% all, because I was dealing with being in constant pain and not knowing at the time that I had lupus, and trying to work in hospital lights, which if you're somebody who is very sensitive to lupus or has lupus and you're very sensitive to lights, then you know that feeling. I was getting sick. I couldn't concentrate. I was just in constant pain. I was constantly flared up. I could barely move, and my back was just giving me a fit. It constantly hurt. I had sacroiliitis, and it was just inflamed. It hurt to sit down. It felt like something was stabbing me every time I had to sit down in the chair, and it just was no longer feasible for me to stay at my job. So it's just a wide variety, and we're not all the same. Some of us all have the same symptoms, and some of us don't. I have only heard of one person that has all of the eye problems I don't know if she has, I don't know if they have all of them, but one person that has even remotely the same eye conditions that I do. Um, so it just affects us in different ways. It affects different organs. It affects different. Some people have it where it affects the skin. Just affects in different ways. So we need to remember that even among us in the lupus community or the autoimmune disease community, just because somebody has the same autoimmune disease that you do, doesn't mean that it all fits the mold. Um, Especially like I said, lupus is such a wide variety, has such a wide variety of symptoms, and there's no way that everybody can have exactly the same symptom. So we just have to keep that in mind with each other and just be that support system and listening to one another. I think that's it. I think I've covered about everything that I want to cover in my video. All right, thank you guys so much and have a blessed day. Bye.